Internationally, the treatment guidelines really vary in the recommendation for the use of EMDR to treat military populations. So the variation in the guidelines, for example, we see in the US, so the practice guidelines by the Department of Defense and Veteran Affairs, there's a strong recommendation that a manualised, trauma-focused therapy, including EMDR, is a first-line treatment for PTSD in military populations. So the recommendation in the US is in line with international treatment guidelines to treat PTSD in general. But contrastingly, in the UK, the PTSD treatment guidelines by NICE recommend that EMDR should not be offered to combat-related PTSD because there's insufficient evidence for this population, and that's actually true. So the randomised control evidence base for this population is actually small. It's also not a surprising recommendation in the UK, considering that at times military population don't respond as well to psychotherapy compared to people with non-military PTSD. The research that underlies the international treatment guidelines that I've just mentioned, there is in the field of EMDR and looking at the effectiveness to treat PTSD in military and non-military populations, there's 24 studies that have examined the effectiveness of EMDR here. Unfortunately, of those 24 studies, 6 of these publications have been randomised control trials, and that's all. Within the randomised control trials, the 6 randomised control trials, there's one study by Carlson in 1998, and this is the only randomised control trial that provides a full course of 12 EMDR sessions to treat PTSD in military populations. Some of the randomised control trials provided between 5 and 7 sessions with positive results, but 2 of the randomised control trials out of the 6 only provided 2 sessions of EMDR to treat veterans diagnosed with PTSD. But outside of the 6 randomised controlled trials, there are 7 other non-randomised controlled studies, and 3 of these studies have examined historical or archival data. In addition to this, there's 11 published case studies or case series that I'm aware of that have included veterans or active duty personnel who've been treated in various settings, so inpatient, outpatient, at home or in the field. So these case series, although not all of them present statistical findings pre and post treatment, but all 11 case series report positive treatment outcomes for using EMDR in this military and ex-military population. So that's the research that's been done. In the randomised control trials that have examined the use of EMDR to treat combat-related PTSD, in the study by Carlson, who provided the full EMDR treatment of 12 sessions to treat veterans with complex or combat-related PTSD, what Carlson found was that EMDR led to significant reductions in PTSD symptoms compared to biofeedback-assisted relaxation and also compared to routine care. And in this study, when participants were followed up at 3 months, what they reported was that 78% of the veterans who engaged in EMDR no longer met criteria for PTSD, compared to only 22% of those who received relaxation or biofeedback relaxation. For the other 3 randomised control trials, the results showed significant effects on EMDR, on PTSD outcome measures at post-treatment, and 3 other randomised control trials. Participants included those in Iran, so servicemen who were admitted to hospitals and were diagnosed with PTSD. They included Australian Defence servicemen with PTSD, US Defence personnel who were treated both inpatient and inpatient and outpatient treatment settings. So overall, if we're looking at the 6 randomised control trials that underlie the international treatment guidelines, 4 of them show positive results when using EMDR to treat PTSD in military or ex-military personnel. But 2 of the randomised control trials, one by Davili way back in 1998 and one by Jensen in 1994, they found no change in PTSD symptoms pre and post treatment. Both of these studies, clinicians provided only 2 sessions of EMDR to treat PTSD in veterans who presented with combat-related PTSD. I think what this indicates is not a lack of effectiveness in using EMDR in this population. I think what it can indicate is that, well, it indicates what clinicians know instinctively working in this area, is that 2 sessions of EMDR to treat a veteran who's experienced combat-related PTSD, it's not enough treatment to lead to clinically meaningful change and reductions in trauma symptoms. We need scientifically sound RCTs or randomised controlled trials with larger samples, and particularly samples that include females as well as males is very much needed. We need to include research in the field whilst treating those on deployment. Future research also has to ensure that we're providing adequate treatment doses for the type of EMDR we're delivering, whether it's treating acute PTSD in the field or full clinical PTSD at home. There is growing research and there's also growing literature aimed with efforts to improve not just how we treat PTSD and combat-related trauma in both military and ex-military personnel. Some of the research I'm familiar with is that I know in the UK there's a lot of funded research underway led by Matthew Kiernan to better understand things like loneliness and social isolation and suicide among military or particularly ex-military personnel as well, so veterans. So I think one of the most important things to understand, and that goes beyond the complexities of just understanding trauma and understanding and taking into account the horrific and chaotic nature of war, what we need to understand is what is it that makes this military population characteristically different from other clinical populations who present with PTSD. And what the authors emphasise is that to work effectively, to work ethically, to establish a really good therapeutic, genuine, authentic working relationship with these people who present with combat PTSD, is that we need to understand the individual characteristics of those who work and serve or have served in the military, and the actual culture of, or military culture as well.